Welcome to another episode of Marketing Tips for Doctors. I'm your host, Dr. Barbara Hales. Today, we have with us Lysa Miller. She founded Ladybugz Interactive, an award-winning web design and digital growth agency serving startup and early start biotech companies to launch their digital brands. The Boston-based agency also works with growing nonprofits, B2B companies, legacy brands, and independent specialty schools. Lysa is also the founder of the Metro West Women's Network, online networking and referral group of 5,000 local women. Her goal, to empower and help local women grow by supporting and referring one another. Recent accomplishments include being featured on the cover of Boston Business Journal's 2020 annual book of lists, named Top Women-Owned Marketing Agencies to Watch in 2021 by Agency Vista, named Top Women-Owned Agencies in 2022 by Cloudways. In 2023 and 2024, the number one on the list of top 100 women agencies by Clutch.co. She has also been featured for her agency expertise in entrepreneurfortune.com, cloudways.com, and Business Insider. Lysa regularly contributes thought leadership content locally and to agency publications and podcasts. Welcome to the show.
Hi, that was a mouthful, but thank you. Thanks for having me today.
Lysa, what are the top strategies you've used to market yourself effectively in your field? And how do you think these could be adapted for healthcare professionals in private practice?
So I think I started doing more of a personal branding approach um, back maybe like 10 years ago before a lot of people were doing that. My background is in public relations and journalism, so I think I have a bit of a knack for that. And also, sort of like in-person networking and that sort of stuff. So that's sort of how I became known, even though I was an online company. People knew the company, but they more knew my name from, my thought leadership, from me being on podcasts. And so that definitely helped build trust in my business. The other way is that, when I do talk to customers, they always remember our name. And a lot of people ask me, like, how did I come up with the name? Like, why do you like the name? And the one thing that just sticks and resonates is that, it was my name when I started out when I was younger. A friend and I started the agency together when we were like 24 freelancers, and I've been kind of going back and forth under that name for many years until I relaunched my agency in 2021. But having a name that resonates with your patients, with your clients, and I think when people can remember you, they can remember your face, they trust you, they'll refer you, and all that good stuff. And that can be online. That doesn't have to be in person. So if somebody Googles a specific physician and there's information about them and accolades and all that different kind of stuff, people will tend to gravitate more to that more well-known practitioner.
What advice would you give to doctors looking to establish their personal brand?
So I think that I do have clients that do have a personal brand, and it's awesome, especially like the millennial age type and younger. But people that are more in my age group, like the Gen X group, I mean, you just can't be afraid of social media. You can't be afraid to put your personality out there. I mean, you can stay away from, practitioner type, things that you can and can't say online, but you can definitely give a brand story. So the client that I have is going through a certain treatment themselves, and so they're posting about that as a physician. So there is definitely ways you can do that on social media. You can also do your own events, like at your practice. You can go out and speak in public. You can, speak at hospitals. There's lots you can do around education to give yourself a personal brand. And you can't be afraid to like take great pictures of yourself and post them and all that good stuff. So I tend to be like, a lot of people say, like, you're an extrovert, and I am when I go out in public and I can do that, but I can't public speak. That is my biggest, worst thing. Being on video is very tough for me, and having a scripted sort of story is hard for me. But so I don't like all that stuff. And people can't believe that I can't public speak, but like I do really well on podcasts. And the reason is because, I'm definitely better at conversational like communication versus, pre-thought out, presentation style. So there's things I can't do and there's things I can do. So you have to pick what you're really good at. And then once you're really good at something, just keep doing it.
Well, it's important to recognize what your strengths are
Mhm.
and then stress those. What
Mhm.
what role or what would you say the biggest challenges that you faced when starting out, and how did you overcome them?
I've started out so many times now because I've owned three agencies. Um, but I think just starting out as a younger person, targeting the right people to be my customers. I think when you tend to start out, you're like, oh, we want everyone, we just want to get work. But actually, just really knowing who your customer is, who your patient is, who your client is, and understanding their challenges, and being able to like meet their needs on like not just meet their needs, but basically, over deliver on their expectations so they have an amazing experience. And then once you create that customer experience, you want to replicate that. So I think that, the thing I did wrong was I just tried to please everyone and be everything to everyone. And I mean, that's okay, I guess, starting out, but those clients do stay with you and they do end up, if 5 years later you're doing a bunch of different stuff and you still have those clients, it's still going to drag you down. So I mean, it's just better to pick the ones that are good for you, do a great job, and try to replicate that. And then once you have that done, and then you want to focus on something else, do that. So with Ladybugz, we started with biotech. When we started over, and then we're like, well, this model would also work for healthcare. So now we focus a lot on healthcare, especially women's healthcare. That's really one of our top industries now. And we did the B2B. We do a lot of big sites, and it's like that's not for us. Like tech, that's not for us. We'll do it, and we've done it because if we're not busy, we'll do it. But in general, like we want to be doing what we're passionate about, which is, mostly biotech, healthcare, and nonprofit, and local people, family-owned, women-owned businesses. So stick to that and just do amazing at it.
Was there a turning point or a pivotal moment that helped you transition from startup to success? How did you seize that opportunity?
I think so. Talking about this agency that I have now, when I started in 2021, I had merged this agency before with another agency. So basically, I was acquired. And so I was there for 5 years helping build that company. But, that company was never this company. So I wanted to go back to this company. And so for me, it was, I think the turning point was just realizing I could do it. Like when I started back out, I'm like, I'm 50. I'm never going to be able to start an agency again. I didn't even think about it. I was just like, what am I going to do with my career now? I've owned an agency, I've helped build an agency. And, I just had to say to myself, like, what do you love? And I started doing work that I love. And from that came ideas of helping clients in a different way that I did before. And once I started doing that and started doing a great job at that, that's when it just sort of skyrocketed. And, so I think, again, it's back to doing what you love. It's back to having a couple of success stories. And then once you do, you'll blow up because people want to work with people that are amazing to work with. And that do an amazing job and that treat them amazing. And like, not everybody's a Ladybugz client. There's lots of clients that are not a client for me and it wouldn't work out. So by trying to avoid those, um, that's the best way to do it. But just again, just doing a bang out job and knowing where you want to go. Like, do you want to blow up? Like, how many clients do you want to have? How many patients do you want to have? How many clinics do you want to have? And asking yourself all those questions first so that you can create a plan like that that's going to really drive the right clients to your business.
What's a common mistake professionals make when trying to market themselves?
I think a lot of um, people make the mistake of really, again, not thinking about a strategy. Just kind of like, let's just market, let's just get on Facebook, let's just go on, like, not really having a plan behind it. But again, if you can do that planning, define who your customer is, actually do the work to make the process that they go through amazing, then that's when you can really drive that. So people just kind of throwing, I'm going to hire a marketing agency and just have them manage my Facebook. Like that's not a strategy. Many companies will help you with a strategy, but I think the strategy starts before that. There's not a lot of agencies that will come in and really help you define who your customer is, tell you how to do a better job in your business. That's up to you as the business owner. And a lot of business owners don't even want to listen to other people because it is their vision. But again, just perfecting that experience for your customer, not even perfecting it, like over delivering. Like the people are just like, I want to use them because they're awesome. And you almost want to create that messaging and that feeling before they even call you or come to you. So that's why that branding stuff is so important because if you're doing an amazing job at these things and nobody knows, well, you're going to get referrals. But like if you want to have that online, that's a really great way to kind of drive a faster, growth to your business is being what you are in person, but online too.
For our listeners that are out there today, what are two quick and impactful strategies they can implement immediately?
I mean, everybody's different, so, it's kind of hard to say what's going to work for everybody. But I definitely think, looking at your business, looking at your clients, and figuring out who the perfect client is probably number one. And then the second thing, and I mean, I guess these aren't simple things, but they're great places to start. And then the second thing is how do I give them the message of that, and how do I reach them? So, and figuring out a plan around it. So first defining everything, getting everything perfect that you want to sell, and then finding a way to deliver it to those clients. And then finding a partner to help you if you don't have time to do it yourself. Obviously, healthcare practitioners are not usually marketing experts, but you can be one if you have time. You can learn, or you can hire a great agency like ours to help you make your way through it.
Well, thank you so much for being on the show today. You've been very interesting, and I'm sure our listeners will enjoy it.
Thank you
That's
so
another
much.
episode of Marketing Tips for Doctors with your host, Dr. Barbara Hales. Till next time.